Hi, this is Dr. Lissa Rankin, and I want to talk a little bit about the difference between healing and curing. Although we have a ways to go, the zeitgeist is catching up to the idea that 85 to 90% of medical conditions are caused by or exacerbated by psychological trauma, and we all have been traumatized to some degree. Science now understands the physiology of how disease-inducing dysregulation caused by the impact of trauma on our nervous systems, immune systems, hormonal systems, inflammatory systems, and epigenetic influences on our DNA expression lies behind most hard-to-treat medical conditions. We now know that the body is a repository for trauma, and its symptoms may betray the secrets that we try to keep or the memories that we bury deep. But what if the body is not just a passive-aggressive toilet that buries our toxins in our tissues? What if the body is actually our greatest ally? What if it's less about keeping the score, bearing the burden, or carrying the weight of our stories, and more like a doorway into an inner world that might reveal vast mysteries and point the way towards not just symptom relief, but also unexpected healing, self-compassion, behavior change, relational repair, community healing, and dare we say, unconditional love. In my medical training, we rarely used the word healing. You might talk about a healing wound or a healing fracture, but to talk about a healing person or healing the wounded heart or healing the nervous system, that was like fluffy woo-woo nonsense. Cure, on the other hand, was the goal. Anything short of cure was seen as a narcissistic injury for doctors who, as a doctor myself, we often like to feel in control, and we prefer to feel like the hero or the heroine who saves the day. There was often little insight in my medical training into the difference between healing and curing, and even less emphasis placed on healing, even if it meant cure might not happen. This all seems now quite wrong-headed to me. As I wrote in my New York Times bestseller, Mind Over Medicine, you can be healed without being cured, and you can be cured without being healed. To be cured means to be free of disease or symptoms. To be healed means to make whole. When you're healed, wholeness is restored at a level that transcends the body, but might also include the body. You can even die healed, or you can heal and be cured sometimes. Sometimes, but not always, when people heal, cure follows. But even if cure doesn't follow, healing is worth doing in and of itself. It's my opinion that when it comes to the relationship between psychological trauma and medical disease, making this distinction is tantamount. Even though the data is clear that the nervous system dysregulation caused by psychological trauma leads to medical disease, it would be unscientific to claim that treating trauma is guaranteed to cure disease. What trauma experts and scientists can claim ethically is that cutting-edge trauma treatments like internal family systems and also others heal trauma. And when you heal trauma, you activate memory reconsolidation, taking advantage of neuroplasticity to lay down new neural pathways. This can fundamentally repattern the nervous system and reverse the chronic nervous system dysregulation, which can lead to a cascade of events that may even reverse medical symptoms. In other words, if you heal first, you might be cured, but there's no guarantee. There are, however, many anecdotal reports from people who had radical remissions and who were cured from so-called incurable diseases. When asked what, if anything, these Olympians of healing did to be proactive about winning the gold medals of healing, many claimed to have done deep trauma healing and intensive shadow work, diving into the most painful aspects of their lives and going the distance to heal from all that buried pain. Over and over, I've heard stories of people with remarkable cures who became very involved in psychological or spiritual self-help work and changed their whole personality, with or without therapy. During the 17 years he rigorously researched radical remissions with before and after medical records, my partner Jeffrey Rediger, Harvard Medical School professor and author of Cured, heard the same kinds of stories. These health outliers simply were not the same people after they recovered from their medical illnesses. sometimes without bypassing, ignoring, or sugarcoating the genuine suffering they experienced. They even wound up claiming that getting sick was the best thing that ever happened to them. Because their diagnosis propelled them to psychologically and spiritually heal whatever was interfering with their best potential life, they might even find themselves grateful for the painful nudge towards healing, even though it often meant their lives and relationships had to undergo significant changes. The linchpin to understanding this concept is rooted in a paradox. Your disease is not your fault, and healing is your responsibility. Even if you've made life or health choices from the parts of you that might be trying to avoid the emotional pain of your trauma, maybe by eating poorly or smoking or drinking too much or avoiding doctors, getting sick is still never your fault. But it does take a conscious choice to embark upon a healing journey and start to take responsibility for healing. Nobody can make you decide to enter the cave of healing, and nobody else can do it for you. And you can't really pressure anybody else to try to make them heal. One of the main limitations that I observe with our current medical care system and the ways that many patients approach it is that everybody seems to want a magic bullet and nobody wants to feel pain, and that's understandable. But expecting to be cured without being willing to do the deep dive of healing simply may not lead to optimal outcomes. Part of the pushback from the conventional medical system against the world of mind-body or trauma-informed medicine is that patients who are already scared and suffering may mistakenly think that we're saying it's all in their heads, or that they're in some way to blame for their illnesses or even for early death. And it's true that some people do feel blamed when we talk about this, no matter how many disclaimers we make, when we share the science linking trauma and disease, or tell stories about how some patients took ownership of their healing journeys and had radically different outcomes. I'm about to prepare to teach a class called Internal Family Systems as Medical Treatment with Master IFS trainer and Harvard psychiatrist Frank Anderson. And we are both really thinking about this as we're going into teaching this class. We honestly aren't blaming anyone for tragic diseases that cause unmeasurable suffering. And we certainly don't judge people who either can't afford trauma treatment or aren't healed enough to let go of parts that might interfere with healing or sabotage healing, or aren't interested in making big changes in their lives, or can't get away from the abusers and their spheres, or aren't willing to dive into the deeper levels of psychological and spiritual healing. I mean, we get it. It is hard work. It hurts to face the past and reckon with what has often been decades of pain. We really do understand why some people might not be up for the challenge of this kind of deep soul work, which is why we recommend against ever trying to pressure someone you love who might be sick into doing deep personal work that they're simply not ready to do. It's fine to gently invite and educate someone about what you're learning, but it's really not okay to cross someone's boundaries or meddle in their business just because your parts might be scared that someone else is going to stay sick or maybe even succumb to an illness. It's important to keep in mind that trauma survivors have often had their agency stripped from us. We need to be reminded of our agency, our autonomy, and as long as we're not hurting someone else's health by doing so, it's ultimately our own right to make choices for ourselves. We have to keep that in mind. When we get sick, everyone is entitled to their own journey. We do not have to obey the doctor's orders or do what our families might want us to do. We do not have to heal. We have every right to control our own choices when our bodies are breaking down. We are not beholden to anyone else to work on ourselves or to stay alive or to listen to any bits of unsolicited advice that boundaryless people might pile upon us, thinking that they're helping us when they're actually interfering or trying to control someone who's in a very vulnerable state. But if someone is curious, open, flexible, and willing to consider getting more involved in their own recovery, if they're willing to face potentially uncomfortable truths that might have been buried in uncomfortable blind spots, if they're motivated to learn to set firm, clear boundaries, if they're willing to work on the parts of them that might not be eating or exercising or sleeping well, if they might consider including cutting-edge self-help tools or trauma therapies like internal family systems as part of a comprehensive trauma-informed medical regimen, then it's possible that your health condition might have a better outcome than if you only did what your doctor ordered you to do. And that's why I care so much about teaching this material. Even at medical schools and hospitals as prestigious as Harvard, physicians and even many psychiatrists and psychologists do not understand the degree to which trauma takes residence in our bodies and changes the chemical milieu in which our cells operate. If your beautiful, brilliant trillions of cells are spending much of their time marinating in the neurochemistry of chronically secreted stress hormones like cortisol, norepinephrine, and adrenaline, rather than the healing hormones of the ventral vagal parasympathetic nervous system like oxytocin, endorphins, serotonin, and dopamine, we know on the basis of both good clinical data and laboratory science that they eventually simply wear out and misfire, attacking the magnificent body they were sworn to protect. Instead of fighting off the mutating cell that will eventually become cancer, if not detected and destroyed, instead of going to war with an invading pathogen like a bacteria, a virus, or a fungus, the body's natural self-healing mechanisms simply begin to break down and may even attack the body with autoimmune destruction. But if we know how to apply the principles of IFS to the healing process, using the symptoms and diseases that our bodies might suffer from as a portal, as a trailhead to healing our trauma, sometimes those symptoms and diseases will disappear. Some kinds of trauma that impact physical health are harder to heal, like social determinants of health, health inequity in our medical system, climate crisis, systemic racism, poverty, food deserts, or the impact of narcissistic leaders who are hurtling our species off the ecocidal cliff for their own self-interested profit motives. But for those who are motivated to do everything within their power to optimize their health, we sincerely hope that learning the practices in the internal family systems model might help when it comes to medical illness and recovery. So I hope that's helpful. I hope you really feel the compassion that comes from understanding why sometimes our parts might be using our bodies to get our attention. And I hope that you can continue to educate yourself and feel inspired and hopeful about the possibility of better health outcomes when we interface with the internal family systems model with relationship to medical illnesses. So thank you. I'm Dr. Lissa Rankin. You can follow me on lissarankin.com. I also have a Substack, lissarankinmd.substack.com, and I'd love to see you there.